it being in a vertebrae, so we'll go over some ways to tell if you're looking anteriorly or posteriorly at it. The easiest thing to do in this model is to look at the vertebrae. This is the body, this is the spinous process here, so this is posterior, and this is anterior. If you don't have a vertebrae to orient yourself with, then there's some other things we can look at. For example, we have the anterior median fissure, which is much bigger than the posterior median sulcus. On top of that, we have a posterior root ganglion, which will help you identify this as posterior. The anterior root does not have a ganglion. So those are two things you can use to orient yourself. Starting with the gray matter, which is internal in the spinal cord and external in the brain, we have the posterior horn, the lateral horn, and the anterior horn. In the posterior horn, we find the interneuron soma, so we call this the sensory nuclei. In the lateral horn, which is only found in the thoracic region of the spinal cord, we have the autonomic motor nuclei, and in the anterior horn, we have the somatic motor nuclei. This is the great commissure right here, connecting the two halves, and then in the middle we have the central canal. Looking at the white matter, which is your myelinated axons, we have ascending and descending tracts in these. This is the posterior funiculus, the lateral funiculus, and then the anterior funiculus. And then on most of your models, there's a little bar of white matter right here, which is the white commissure. Off the anterior root, we have off the anterior horn, we have an anterior root. Since this is a motor nucleus as well as this, we have axons traveling in the anterior root, motor axons. In the posterior root, we have sensory information coming in. So in this posterior root ganglion, we have the sensory neuron cell bodies, which is what a ganglion is, a group of neuron cell bodies outside of the CNS. Sensory information gets sent in. So this is that little acronym, DEVO, dorsal in, ventral out. Okay, so sensory information comes in, motor information moves out. When we are looking at the meninges, they're a little different than in the brain. We have an epidural space, which we do not see in the brain because our brain dura mater has two layers, the periosteal layer and the meningeal layer. And the periosteal layer keeps it attached to the skull. In the vertebral column and the spinal cord, we only have one layer, and it's the meningeal layer. The next blue line is the arachnoid mater. And then this space right here is the subarachnoid space. This is where the CSF fills. And then if you guys look, there's this little raised portion right here. This is coming from the pia mater. This right here is the denticulate ligament. This is helping to anchor the spinal cord within the vertebral column. We have the combination of the anterior and posterior root right here, forming the spinal nerve, and then it splits again. We have the anterior ramus and a posterior ramus. The posterior ramus is going to be smaller. It will send nerve supply to the deep muscles of the back and the skin, where the anterior root will supply the rest of the body, whether that be the front of the trunk or the upper or lower limbs. The anterior roots also give rise to our plexuses. So, all right, there's your spinal cord. Go ahead and say that.